So I'll just introduce myself first. I'm Svante Myrick. I'm the president of People for the American Way. And it is my sincere pleasure to be able to work with some of the folks we have on the call to talk about the healthcare crisis in America right now and why it is that we support the Democrats' actions um, to reduce healthcare costs, to help the American people live lives of purpose and satisfaction, and why we're calling on the Republican obstructionists in Congress, those who've been attempting to tear down Obamacare and to increase people's out-of-pocket costs. We're asking those Republicans to stand down, to do the right thing and improve the quality of life here. So my life, I think most people's lives actually starts with a healthcare story. If
Mm.
you're lucky, you're born in a hospital, and I was, but I was a blue baby, which means the umbilical cord was wrapped around. It's not a partisan term. I came out, my head was real big and blue because the umbilical cord was wrapped around my head, and we had to stay in the hospital for weeks and in an incubator. But because we were actually, I don't know, we were in North Florida, and there was no um, parental leave. So my mom was laid off from her job as a cook at the diner 2 months before I was born. My father was in the Navy. We started using drugs. It wasn't good drug health policy then either. So I spent the first 6 months of my life in a homeless shelter when we came home from that hospital for the first 8 years of my life in and out of homelessness. And I came to believe what my mom always said, and you really experience now as an adult, that there really are only two kinds of problems: health problems and money problems.
Mm.
Everything else can seem like a problem until you run into one of the big two, a health problem and a money problem. And in America, far too often, those problems compound each other. We have, you all have, the folks you're going to hear from today have constituents whose health has been compromised because they've had to defer the kind of routine maintenance that could make them healthier over the long run and actually save them money over the long run, but because they were uninsured before Obamacare, they didn't feel comfortable even going to the dentist or the doctor. There's people whose the stress and agony of the bills stacking up has sapped their will to fight the kind of diseases or illnesses that so many of us will face in our lifetime. All of this human suffering, and that's what it is, suffering, could and was being relieved by the federal government. That's the amazing thing. That for the last 10 years, the federal government has actually, through Obamacare, insured tens of millions of new people and lowered the cost of that insurance. And now, as the Obamacare programs are being allowed to lapse and being canceled by Republicans, folks are seeing their premiums double and triple. These are working people with no other options, people without the thousands and thousands of dollars that this will cost. So that's what we're here today to discuss. I'd like to introduce you all en masse, if that's okay, and then ask questions, and then I'll ask a question and ask you to answer in line, if that makes sense. I'll start on my screen from left to right with Representative Eskamani, member of the Florida House of Representatives. The first, I believe you're the first Iranian American elected to the Florida legislature ever, right? Bachelor's, master's, and PhD, all from the University of Central Florida, because that's how much she cares about Orlando. And she cares so much about Orlando that 2 years from now, she will be the mayor of Orlando, if and when her election is successful. One of my favorite elected officials, and certainly my favorite Florida elected official. Oh, wait, no, wait, I have two other. Okay, my favorite one on the. No, no, and it's you. It's you. And I'll deal with the rest of I'll deal with those other two later. Next is Donovan. Donovan McKinney, just amazing young man, still young, I must say. If you're younger than me, you're young. Uh, of course, serving in the Michigan House of Representatives, where he brings such passion and energy and intelligence, comes from growing up being a product of Detroit Public Schools, fighting his whole life for his community. And now he is running to represent Michigan's 13th congressional. When he wins, he'll be one of the youngest members of Congress in the country. Dorsey from Albany, New York, chief city auditor for the last 5 years. Before that, she's on the city council for 8 to 10 years. 7 years, 7 years on the city council. So almost a decade in service to the city, where 1 month from now, less than a month from now, about 3 weeks from now, when she wins her election, she will become the first Black mayor in Albany's history. History on the Hudson, very, very important person in my home state of New York. We love Dorsey and really appreciate you being here in the midst of an important election season for you, of course. Ashley from Cedar Rapids. This is your third reelection, or this is the third reelection. She's running once again unopposed in a city where that is not usual. Those who know Cedar Rapids in Iowa know that it is very civically and politically competitive, never contentious. This is an Iowa way, of course, but very competitive. The reason she wins so handily is because I think, if you don't mind me saying, actually, her grounding. I heard that she grew up with a family farming background, and now her work in healthcare, it really grounds her not just in what we're here to talk about today, but in the everyday needs of her constituents. Really powerful and important leader in Cedar Rapids. And finally, Adorian Murray Thomas from New Jersey was elected just a couple years ago. I feel like you are the newest of us. Are you 25 now? That's way too young. I think we can agree. I was elected mayor when I was 24. And frankly, I look at the pictures I'm like, I'm not sure I would have voted for him. But I would vote for Adorian because in just a couple years, she has made a remarkable impact, particularly on those who have been the victims of violence, or those who fear violence on the streets, and of course for girls and young women in particular. She's been an incredible commissioner there in New Jersey, and just really, really proud to have you all. Should we take the questions in that same order? What do you think? Is that okay if I start with Anna and then move down the line? I'll ask just two questions because I'd ask you all to keep it to just a couple minutes, but I know you all. No. I'm going to ask you all to keep it a couple minutes per answer because we have a couple questions, but we also, attendees are able to, and I'd like to encourage any attendees here to drop into the chat any questions they have so that we can fit in as many as we can. So the first question, and this, and I'll start with you and we'll keep going down. All of these cost increase that we're saying, if Republicans allow the healthcare costs to increase, if they don't work with Democrats to extend the Obamacare benefits, what do you think is the combined effect on your constituents of those increased health costs, along with what other impacts are already being experienced by your constituents with this administration's policies?
Well, thank you so much for having us. And it's always an honor to join my colleagues from across the country at the local level. As we're the closest folks on the ground, we're seeing the impact that our constituents are navigating with the affordability crisis every single day. And often when they call our offices, it's out of pure desperation because they've tried 211, they've tried fighting with an insurance company, they've tried every other alternative, and they come to us seeking that last final ask for support. I want to provide the context to my district. I serve in Orange County, and of course, we're a service-driven economy in Orange County, so we have a lot of everyday Floridians that already struggle to make ends meet, who are working very hard, but are up against tighter and tighter budgets where there just aren't any more loops on the belt, if you will, to tighten. Now, with that said, despite the political rhetoric that comes out of Florida, and despite the legislature's consistent opposition to the Affordable Care Act, it's worth noting that Florida is one of the most successful states as it pertains to enrollment with the ACA. And this takes me back in time to when I was a college student at the University of Central Florida, because I was first elected in 2018, but I was a college student in 2008. And that was the first election of President Barack Obama. And of course, that's where the healthcare fight in Congress first started with so called Obamacare, as many folks know it as today. And we fought really hard in Florida, not just for the success of the ACA, but then for its enrollment. We worked on the ground with healthcare navigators, going to neighborhood events, mobile units. When I worked at Planned Parenthood before I ran for office, we would host enrollment periods and healthcare navigators in our waiting rooms to make sure patients knew what their options were. And all those efforts of folks on the ground has led to Florida having more than 4.7 million people who are enrolled through healthcare.gov for access to their care. 4.7 million people. That's about a quarter of our state. Florida has 22 million people. And of course, another 4 point some million people are Medicaid recipients. So any cuts to Medicaid are also going to harm the people of this state. And so these tax credits are essential. You know, we are home to the heart of the working class in our state, a very diverse constituency, and folks who are also have the entrepreneur spirit that defines us as Americans. They want to do good, and they also want to support their families while they work hard. And access to healthcare is key to be able to support their families. I also want to acknowledge you asked what are some other ripple effects we're seeing. So I'm here in Tallahassee, in the state capitol. We're in committee weeks as we prepare for legislative session in 2026. Last week, I had a committee hearing where the Department of Children and Families provided us with a presentation of the impact of the HR 1, in my eyes, known as the Big Ugly Bill, of what that impact means for Floridians. There are going to be 181,000 Floridians who once were exempt from the administrative burdens attached to food stamps who are no longer going to be exempt because of that bill. And that includes veterans, it includes foster youth, it includes asylum seekers, refugees, immigrants with legal status. 181,000 people in our state who currently rely on food stamps to get the ability to have a nutritious and basic needs met, who are now exempt, and they're having that exemption be pulled away from them purely for politics. And that includes veterans. I mean, it's just shocking the ripple effect coming from the federal government, whether it's the firing of federal workers, slowing down our basic government services, whether it's giving these huge cuts to social safety nets for billionaire tax breaks, or in this case with the Affordable Care Act, pulling back what are essential needs, essential subsidies for 4.7 million Floridians who need them. So it's a bad situation, only going to get worse. And I have to tell you, the main issue that comes to my legislative office has to do with affordability. It's the cost of housing, the cost of rent, the cost of utilities, the cost of groceries. People are really struggling right now, and we need congressional Republicans to get their heads out of the sand and acknowledge the fact that their policies are hurting our families, that their policies are not saving people money, that their policies are creating chaos. And it's really important for us to make decisions in the best interest of our constituencies and not on party politics.
Amen. Thank you so much. Donovan, same question. What are these increased costs in Trump policies doing to your constituents?
Great question. Just like the representative before me talked about what's going on in Florida, here in Michigan, for those folks who don't know, I represent the poorest house district in the state. The average median income is around $14,000. So just imagine living off of 14,000 a year. That's a little over 1,100 a month. And with the average rents in our area being anywhere between, depending on the data set you look at, anywhere between $1,200 to $1,800, that's pretty much all your money down the drain. And you have to worry about, we have some of the highest auto insurance rates in the country. Then you have to worry about, gas, groceries, utility costs. energy, to water, things of that nature. And so people are worried about the kitchen table issues. And right now, they're not seeing any relief from their government, especially on the federal side. And so, with these healthcare subsidies and attacks on the ACA, Medicaid, Medicare, it is unbelievable the strife people are under and the fire they're under. I literally just had a constituent reach out to me, sent me an email talking about, and I'll read it verbatim. As someone living with a disability, Medicaid literally keeps me alive by covering my prescriptions and treatments. With this shutdown and rising drug costs, I worry every day about whether I'll be able to afford the medicines I need to survive. And we all know that Medicaid and ACA ensures access to life-saving prescriptions and treatments for people with chronic illnesses and disabilities. Rising drug prices will force families to choose between medication, groceries, or rent. Cuts to Medicaid disproportionately harm women, children, seniors, and family with disabilities. This shutdown creates fear, uncertainty, and dangerous barriers to healthcare access. But the Republicans are blaming it on the Dems. In reality, they have the trifecta in D.C. And it's their responsibility to ensure that these cuts no longer take place. We did what we could do. I'm on the appropriations committee in Lansing in the state house, the only Detroiter on that committee in the house. And we did some things in this particular budget with a lot of one-time funding to protect a lot of the folks' healthcare in our state, but more importantly, soften the blow of what's coming down from the federal government. But it's only one-time money, right? It's not a long-term sustainable solution. And so, if we do not get this done and we don't lock arms and really fight together to protect folks' healthcare that we all know and love and serve, folks are it's a rude awakening years down the line, not just this upcoming year, but a lot of budget years down the road that the states they just don't have the ability or the money to, circumvent a lot of those cuts. So we need our federal government to step up and keep these subsidies rolling.
Well said. Well said. I believe next is Dorsey.
Thank you so much, Svante. It's always good to see you and all of my colleagues here. Um, I think it's a very simple equation. When we talk about cuts to Medicaid, that equals poor health outcomes, meaning people who are already severely sick, who have chronic issues like diabetes, heart disease, cancer. We will see those individuals get sicker. Cuts to Medicaid also equals death. And while we don't talk about it in simple terms, the reality is with these cuts to Medicaid, we will see more people die. In the health world, we talk about increased mortality. What that simply means in layman's terms is that more people will die. This issue is being tossed and talked about like a political football. But what we are forgetting is that these decisions impact everyday people. For example, when I campaigned the first time for city council, I was a doctoral student at UAlbany. I have a master's and doctorate in public health. And so as I was out talking to residents, I was always intrigued by how they were living their health, because your health is your wealth, and the health of a community it's critical. And Miss Mary, who I was talking to, raising 3 kids, but also her granddaughter, Miss Mary complained to me about her toe that was black. And so I pushed Miss Mary to go to the hospital. What we know, Miss Mary lived in a low-income housing community, very reluctant to go to the hospital, distrust for healthcare system, et cetera, et cetera. I ran into Miss Mary not too long ago. Miss Mary is now a W amputee. Both legs have been cut off because of her diabetes and not seeking health care and treatment early on. This case with Miss Mary is so typical for so many Americans who will be impacted mostly by these cuts. People like Miss Mary, who are low income, children, those who have disabilities, those who are among us who have the worst health outcomes. And so we have to humanize this conversation and stop talking about it in a very abstract way. To your latter question, Svante, in terms of additional cuts and the implications of what we will see right here on the ground in Albany, in addition to more people being more sick and more people dying, we're also looking at delays in funding to summer youth employment funding, the funds that we use from the federal government to pay our kids who work. And so we know in Albany that many of those kids who work, that money is not just pocket change to go to the corner store to get a can of soda. That money goes back into households because many of those families don't make a lot of money. And so in addition to the poor health outcomes that we'll see, we'll also see families who will struggle even more because of some of these decisions.
Thank you, Dorsey, and thank you for sharing that difficult and real anecdote. I mean, really brings it home. Ashley, of all of us here, you I know have your master's in healthcare administration and work every day inside the system trying to deliver healthcare to people. I'd like to ask you the same question, and if there are stories you feel comfortable sharing about the need that your constituents are in right now.
Yeah, so in our form of government, we're part-time council members. So I do work full-time, have professionally worked full-time in healthcare for 12 years. Presently, I work in specialty clinics over pediatric cardiology and maternal fetal medicine, which is high-risk OB. So the stories that Dorsey shared about diabetes are really important because they intersect both of my clinics. And I always say colloquially that, at the intersection of both of my worlds, I have the privilege of looking out for the welfare and well-being of my residents, full stop. That's what I do in my life. So it's very personal to me because when we're talking about these things policy-wise, right, I see the faces every day that it actually impacts and the families coming through. And I think there's quite a few things here in Iowa. We're in a maternal health care desert. In both of my specialties nationally, there are shortages of professionals, both providers and imaging, which is very vital for both. Let alone, there's just a general writ large nursing shortage as well. So it is a very concerted effort to keep these going. Most of the folks coming to my clinic, we're serving, half of Iowa. In Eastern Iowa, it's either us or the University of Iowa that you can go to, or you can go to Central Iowa, or you can go, all the way out to, there's really just 4 places that you can go in Iowa. So when you factor that in, you also have to factor in the fact that people are driving, upwards of 2 or 3 hours to get to your clinic. So imagine that you now are, a parent, prospective parent with high risk needs, and you're trying to hold down a job. Now you have your primary OB appointments. Now you have your high risk OB appointments. You might have endo appointments just for diabetes. And those are just some of the more routine things that we see. So it's difficult to put it in context of how much this matters. I actually have really spent a lot of time pondering what a weird timeline we're in where my Venn diagram is overlapping Marjorie Taylor Greene's, saying like, this is really important, but here we are. And I'm grateful that she's taking it on the chin about that, because this is really important. It's important to everybody. This is not a partisan issue. It should never have been. And the reality is in Iowa, it's further compounding because of some poor choices that happened in 2024 in our legislature. We were asked, and so wearing both of my hats, I leaned into my colleagues in elected office and explained that, we were had Medicaid through Iowa at a 380% poverty level. Republicans who were in a supermajority, thankfully we just cracked that recently, but we're in a supermajority at the time, decided that people just need to pull themselves up by their bootstraps, regardless of whether they had boots to begin with, okay? And so people just need to get back to work, they need to work harder, and they need to stop living off the government dime. And so they wanted to propose to reduce it very, without heart, without any human compassion of the realities of what people are in, from 380% to 220. We asked as a healthcare institution, and Cedar Rapids is Iowa's second largest city. So, you can imagine the populations that we're serving and just the burden we have here to manage as many people as possible. But, we asked for them to not reduce it any more than 300%. We said, you know what, we'll figure it out at 300%. That still is a huge cut. It's going to impact a lot of people, but let's keep it at 300%. And they said, nah, we're going to do 220. And my conversation face to face with the people that I've built these relationships with is, I want you to know the names of the people who you will impact, and know the names of the people who will die because of this, and know the names of the families that will have to support because they can't get the timely care, or they have to skip appointments, and whose, fetuses will die. And the impact that will have. They will be some of your constituents who voted your way and voted for you. And I just need you to know that I'm going to hold you personally accountable for that. Their response back to me was, well, you can't do that. You can't put that on me. I said, I absolutely will. I absolutely will. And you'll be hearing more from me. Unfortunately, that's where we went, but this will further compound that, right? Because we've already dropped that from a state impact level. And now this will further complicate it from, what some of those federal standards are. So, Iowans, I think, are in a very precarious situation. I'm extremely concerned about just their ability to maintain basic needs for healthcare.
Thank you, Ashley. And I do have more questions for you later as time allows. Dorian.
Yeah, thanks, Svante. Thank you for hosting this forum, and just really honor to be here with my distinguished colleagues from across the country. As everyone shared, I think what we're seeing right now is just another evidence of the bankruptcy of American values that everyday working people have to pay the price of. Similar to my colleagues in my particular state of New Jersey, we have 1.8 million people who are covered by Medicaid, about 513,000 who are covered by the Affordable Care Act. But I want to talk specifically about my own backyard here in Newark, here in Essex County. We are literally 1 out of every 2 residents in our county are either covered by Medicaid, Medicare, or are uninsured. Now, what does that mean? That means that they are hit the hardest by these cuts, not only the projected cuts with this potential budget, but also with literally what's going on right now with the actual shutdown. We talk about what's happening in this moment with the service disruption because of the shutdown. I think about my own family. So I live in New Jersey, but like a lot of Black folks who migrated to the North, our folks come from the South. So my grandmother is still in South Carolina. And literally just this summer, when we found out that the breast cancer returned, and we had to, see where she would get her surgery. At this point, it had escalated to a mastectomy so that we could ensure that the cancer wouldn't come back. It was a blessing that we literally were on the phone with a nurse who said, this hospital that is potentially going to do your grandmother's surgery may experience service cuts because of the new budget. And so we actually recommend that you find another hospital for your grandmother to have her surgery. If it hadn't been for the everyday support and care of workers like the healthcare worker, we wouldn't even be able to afford for my grandmother to have this life-saving surgery. But here's how these service disruptions that are caused by the current shutdown are affecting workers like her, who called us and helped us figure out how to help save and afford my grandmother's health care. What we know is that because of this government shutdown, everyday workers whose wages are covered by federal subsidies aren't getting paid, or their pays are getting delayed, or there's a likelihood that their hospitals and service providers will lose that coverage. We have to think about our workers. We have to think about those most affected by healthcare, and we have to do something. I'm reminded of my own young person, Lakita, who, as you mentioned in my introduction, is really like my coach. She was like my mentor. She was 14 and I was 20, figuring out if I was gonna actually say yes to running for office. And she said, you told me to run for class president, you should run too. Well, her senior year of high school, she was applying to colleges. She ended up being in a car accident that paralyzed her from the waist down. today. She survived that, thank God. But she still is paralyzed by the waist down. And I remember when she was choosing between being able to have life-saving wound care coverage and spinal cord recovery after her accident. Now, this was in 2022, 2023. I say this to say the healthcare system wasn't perfect then, and it's not perfect now. But people like Lakita, people like my grandmother, people like all of the different constituents that we've mentioned today will continue to be hurt the worst if these premiums increase and if this government shut down because of Republican refusal to stick up for Americans continue. So we have to do something. We have to do more, and we have to continue to push our local leaders, our state reps, and folks around us in just to do what they can in the event of these federal delays continuing. We have to find other resources to make sure that our hospitals, our clinics, and our everyday providers have what they need to take care of our people.
Thank you so much. Can I ask, okay, so this is heartbreaking for several reasons. The one that concerns me, and this is a question I'd like to ask about numbers. The Republicans are kicking 15 million people off of their insurance, right? They say to save money, but then I looked at the bill. The bill doesn't save any money. The bill increases the federal deficit by $4 trillion. $4 trillion. Okay, so we kicked 15 million people off their health care, but we didn't save any money. How did that happen? Turns out they gave a lot of money to very rich people, to millionaires and billionaires especially. I don't know if you know this, but if you make more than $500,000 each year, if you make more than that by yourself, 500,000 or more, you'll get a tax cut of $47,000 next year, right? The vast majority, the billions and billions of dollars that are being saved by taking money away from people's health care is going to billionaires. So I have a two-part question. First, the billionaires in your districts, are they okay? Do they need anything else? What more can we do for them? That's the first question. So if they need anything, like if their yacht needs a smaller yacht that can dock on their yacht, let's write those down. The second thing.
Firstly, Svante, I think it's a moral problem that we have billionaires in the first place.
A moral problem and a policy failing.
Right.
Right. So let's get into this. Okay. So I want to ask, and everyone take this up as you can. Are the billionaires fine? Do they need anything else? Second of all, $4 trillion, get very specific. With $4 trillion in your communities, right? What chunk of $4 trillion, what could you actually see improved? In Ithaca, I could imagine another hospital, 2 more elementary schools, a mobile dental clinic that rolls from block to block, right? What with a fair share of that money that they're giving away to billionaires, what would you see built or created in your districts?
I'll just go ahead and say, from an economic perspective, the way to induce savings in healthcare is actually to educate and roll out as many preventative measures as possible. If you educate folks about what that is and you catch it early on, then you're not staving off because effectively the plan would be if people are cut off of their insurance, they can't afford it, rates double. We've seen these figures where you're kind of seeing a side by side where today and propose where it's like 300, 900. People aren't going to be able to accommodate that, right? So they're going to skip appointments if they can afford it at all. There are too many, unfortunately, catastrophic insurances that are available on the ACA marketplace right now. And people don't really get that buyer beware warning. And so they get it because they think, okay, well, I'm doing the right thing. I'm doing the responsible thing. I have a marketplace insurance. However, you can't use it anywhere. Right? Or you can use it, but it's an hour and a half away or it's 2 hours away because you can only really use it at the public hospital because it's not going to cover everything. And taxpayers are ultimately going to subsidize it in the end when you cannot afford the full bill. So that's the reality. So you have to invest in, and it is an investment in, right? Preventative measures to stave off the highest cost specialty cares that happen when you don't get ahead of it from the beginning. And staving off those really high dollar tickets when things are so emergent or people have no other option but to utilize EMTALA and go to the emergency departments. that is the most costly thing. So the more that we can do on the front end, have people come in for preventative, annual exams, vaccinations, all of the things like that, that's the best case scenario. And that actually, ensures us those cost savings that people claim they want to pursue.
And I would just add to that. I think the challenge when you have decision makers who are out of touch with everyday people, who don't live in these realities, who don't understand the importance of prevention. We have these really dumb decisions that unfortunately will lead to people dying and people being sick. What we know in public health is that we can predict people's life expectancies by looking at their zip codes. That is the unfortunate reality of the country that we live in. And typically, when you start looking at zip code level data, you get a more holistic picture, demographics, race, etc. And we know that one thing that you can never take off the table in this country is the impact of race and racism, and how race and class really drive and inform policies as it has with these cuts that we're talking about. The people who will be impacted mostly are low income people, Black and brown people, rural communities. The last point that I'll make is that when we talk about the billionaires who stand to benefit, again, these are folks who have really never had disruptions in healthcare, never had disruptions in housing, never experienced food insecurity. And so they have no idea what the everyday person has to deal with and contend with. And because of that, again, the fallout will be the people who actually are closest to the pain, closest to the problems, will experience more pain and more problems. And so it is imperative for all of us, as was said earlier, to really lean in, holding our Republican colleagues accountable, even for some of our folks in our rural communities who supported and voted for some of these electeds, to hold their folks accountable, because they too will be on the receiving end of some of these dumb, ridiculous policy decisions that have been made.
I'll chime in. First of all, I just appreciate everybody's thought process on this because I ditto to all of that. I completely agree. But I want to kind of turn the discussion a little bit to why we have to suffer in the first place. Like, why are these decisions being made every single day on our behalf that benefits the ultra wealthy instead of the common people? And it's because of money in politics. And so I introduced some legislation last term. It just got reintroduced a couple months ago. Right now, the state board of canvassers just approved language for groups to collect signatures based off our legislation, which takes all corporate monopoly money out of politics in our state. And they're also collecting signatures to tax the wealthy to fund our schools. And so, when we talk about 4 trillion and like where those investments can go, it can have a lot of impact on socioeconomic class status and period, just quality of life issues across the board. I'm thinking about earned paid or paid family leave. I remember a story that happened in my particular life when my child was first born. My oldest son, he's 3.5. He'll be 4 in January, 3 and some change. And I remember like my wife and I enjoying those early precious moments, skin to skin contact with our firstborn. And I remember next door, it was still like remnants of COVID. So they didn't have like all the family could come visit. But I remember right next door to a room, the mom was there with her daughter. Her daughter just gave birth, literally right after us. And her mom rushed her she worked in retail at the mall. So rushed her from work to give birth And then literally less than 48 hours later, this woman is getting wheelchaired out with her mom. And I saw this. And I talked to her mom about this. But literally getting wheelchaired out the hospital so she can go to work Monday morning. She came in that Friday evening, left Monday morning so she can go to work because we don't have paid family leave in this country. I mean, like it is just unbelievable. And I
Yeah.
remember that is like imprinted in my mind to this day and why I continue to fight. But when we talk about that 4 trillion, it can be used for so many great things to uplift our family members and keep people together.
Can you imagine 6 months of paid leave for any person who gives birth to another person in this country? A year of paid leave. What would that do for the bond between children and their parents? What would that do for the lifelong learning and brain development of those young people? What would it do for
Yeah.
the happiness? I don't know if any of you have met new mothers or lived for a time with a new mother. Uh, it is brutal. I mean, it's
Mm.
exhausting, and it takes out of you everything that could be taken. The idea that you could
Amen.
also need to get to Story said, amen.
Amen.
The idea that you also then need to get to Foot Locker by 9 o'clock on Monday is in a
Savante,
country in which we can afford to give billions of dollars to billionaires is amoral, as Ashley said, and a failure of policy that these Republicans continue to perpetuate. Sorry, somebody was trying to
that was
jump in while
me.
I was mansplaining childbirth. Was that you, Dorian?
It was, you
Okay.
were not mansplaining. You were providing necessary context that was affirmed by a mother on the
I
panel, Mayor
do.
Dorsey. So you
I do.
clearly are on the,
I tease. Okay.
but I just think it's interesting that you, Representative McKinney, are all referring to, this knowledge that, and when a mother gets skin to skin contact, a lot of this stuff comes from research. And research is the main thing being attacked by this administration. I know I'm on a panel with two doctors. We got, Representative Escamani and Dr. Dorsey. You guys spent a whole lot of time researching things. And you guys can attest, as to all of us, is that it's alarming that one of the main things this particular administration is attacking is information and access to information, research, federal grants that are going to life-saving research around sickle cell, around maternal health, around so many different things that we're talking about, asthma and different things to prevent the health crises that we're seeing directly affect our hospitals, communities, and clinics today are the main thing being attacked. So it's just important to lift up that when we attack what a people know, we attack what they can do. And we attack how they can survive, and not only survive, but can liberate themselves. It's important for us to also pay attention to those through lines here. And that's why I'm so inspired by young people, because young people are standing up across the country and they're saying, we know who we are, we know our voice, we know our rights, and we're going to use that voice to make a change.
Amen. To that end, I'd like to get on this last question that came from the audience, which is, I'm with you, Dorian. I think the rage, the righteous anger that is coming from young people, in particular in this country, can cause, and hopefully will, and we intend to do our part, a wave of elections, a series of elections in which people are put in power who actually, as Dorsey said so well, who actually are in touch with the real lived experience of working people in this country. But right now, Republicans are saying, hey, Republicans in Congress being led by Mike Johnson, saying, hey, just open the government and then we'll talk about these healthcare issues. Right? Now, is that trust me, promise enough?
It's a trap.
Yeah.
We know it. It's a trap.
Right. Absolutely not. Yeah. I mean, and we have to have our non-negotiables, as Democrats. And so it's so important, especially on issues like healthcare. We just walk through some of the reasons why healthcare is out of control in this country. And I do want to just continue to echo this point too about just corporate consolidation, monopolies, and the fact that many consumers have no rights, and that the Affordable Care Act tried to establish some rights. It was a good starting point, but we're nowhere near finished in the efforts of ensuring that every person actually has access to healthcare. And I think that's a really important point is we should be not only demanding for the bare minimum, i.e. maintain the tax credits, but we need to be demanding more. We need a single payer system. We need to make sure that every person has access to insurance, regardless of how much money they have or don't have, and ensure that healthcare is a human right versus today, where it's very much, as we just talked about, determined by your zip code or your employer or so forth. But no, we can't play this game. We're talking about people's lives. We cannot play games
Yeah.
with people's lives.
Yeah.
Mm.
Especially games with folks who've proven themselves to be unreliable negotiators. I mean, they said, look, we're not going to appoint Merrick Garland because it's in the last year of an election, but just trust us. These are the rules. We're going to stick with it. Right? Ruth Bader Ginsburg died. They said, quick, quick, quick. And they
Mm.
slammed through a judicial nominee into the Supreme Court in 2 months. And over and over again, this generation of Republicans has just lied directly to our faces during negotiations. And I don't think it would be wise to trust them at all. I don't think it'd be
No,
wise.
and frankly, trust is earned. And so they haven't, had a baseline of proving to us that they deserve to be entrusted with this, that they are a partner that is coming in good faith. But I think the reality is when it comes to healthcare, we could be great, right? If we want to rebrand that Make America Great, we could actually pursue health in the US with being as resourced as we are, having as much, national wealth as we do. It is absolutely, really abhorrent that people are in such dire straits as they are health wise, because at this point in time, our healthcare system just band-aids people. And it's not because of the people who are working in healthcare. They are some of the most incredible people I've ever had the privilege of working with. But the reality is we need to be pursuing wellness and chasing that, right? We are just patching people up until they die at this point, because we don't actually see healthcare as a human right. We don't. And it would be great if we actually started there first, because if we started pursuing wellness and chasing that, everything else would come into place. Sick leave would go down, the economy would go up because people are showing up for work better, more mentally prepared. They'd have the access to when they're at work in their, whatever their respective positions are, they can actually be present and focused and not so concerned about all the things. But we're quite a far ways off from that. That's what I hope for, though.
Amen.
And
Me too.
I just say
And yeah, please.
I proudly stand as one of the 92% um, who didn't trust then and don't trust now. I think the reality is the only thing that we can trust is that we will continue to see some of the reckless decision making that we've seen, and with an aggressive and bold 2025 policy agenda being rolled out and rammed through. Unless we continue to activate, advocate, and mobilize, we will continue to see the damage and effects of this administration.
Absolutely. And just
Amen.
want to, oh, go ahead. I'm sorry.
No, go for it. Go for it.
No, I was just gonna say, just want to highlight our Vice President forever, Kamala Harris's point, and she talked about this time and time again, about her disappointment. She knew this was going to happen. She talks about it all the time. She predicted this was going to happen. She was telling us this is going to happen. What this administration was going to do with the whole Project 2025 thing. But I'm kind of paraphrasing, but she felt disheartened and brokenhearted to some degree because of how many folks are capitulating to what's going on. And so, to my Democrats in the Congress and the Senate, we need you to stand strong. Do not capitulate. I don't even give him the decency of calling him our president. I call him the orange man in my district, and people laugh all the time. But do not let them win. We cannot afford it. Our country, let alone the people we represent and the families that we care about, are all dependent on us to fight like hell, to ensure that their rights are protected, especially when it comes to this healthcare. So keep fighting. We're standing strong with you, but just wanted to put that out there. And to my sister in Newark, go ahead.
Going on, brother Detroit. I see you. Yes, I
Likewise.
appreciate you. Yeah, just building on what my colleagues have shared. We don't have the luxury in cities like Newark, Detroit, Orange County, and Cedar Rapids and Albany to trust unworthy people and unworthy systems. We don't have that luxury. We have to trust ourselves. We have to trust our work. And I think back to folks like the founders of the Black Panther Party, when they realized that the government was not working for them, they said, we got to do it on our own. And so they created schools and they created community clinics and they created free breakfast programs. I think about the legacy that still lives on in all of our communities today through mutual aid networks that exist. We think about COVID, there was government that stepped in, but there were everyday people who the government failed who stepped in too. And so how do we support those on the ground, mutual aid networks, everyday folks who have always known that if they come for you in the morning, they're coming for me in the afternoon. So we have to lift ourselves as we climb. We have to ensure that we are building rafts, life rafts for us to survive these storms that we did not create, but that we must get through. And we do have to hold those who are elected and are running for office accountable to making sure that we do survive these storms. And in New Jersey, we have an essential governor's race right now going on. We're one of 2 states in the country with a gubernatorial race, and it's going to be close. And so I'm grateful for a network like the official support in our case, Mikey Gerald, someone who gets that we have to support working people, we have to support essential workers and those on the front lines for healthcare, and make sure that folks don't just survive but thrive. But it takes all of us. It takes all of us inside the system and outside the system as well.
Well, I want to thank all of you for taking the time to provide this briefing. Obviously, there's so much attention on those in Congress who are doing or not doing their jobs. You who must do your jobs every day to deliver frontline services, we need to elevate your voices more. So it has been my pleasure. It is our pleasure, People for the American Way, to be with this team of superheroes. Cedar Rapids, the once and future council member as she runs unopposed in Cedar Rapids, Iowa. Representative Escamane, the excellent from Central Florida, who will be the mayor of Orlando, Lord willing, and if People for the American Way has anything to say about it. Representative Donovan McKinney, who's going to become one of these do something congressmen by 1 year and 3 weeks from now. Dorsey in 3 weeks will be Madam Mayor, and well overdue. And Adorian is going to continue leading us and leading the state of New Jersey in the right direction for her generation. You'll teach me what TikTok is later, right, Dorian?
I'll do what I can. I'll do what I can.
Okay, I have questions. Thank you all so much for being here. Really appreciate it. Thank you all for joining us too in the briefing. And we'll keep up the fight. We have to.
Thank you for your leadership.
Thank you guys so much.